It often starts with a sudden shift in behavior. A dog that usually barks at every passing car goes silent. They refuse to sleep or leave a specific bedside. Sometimes they sit in the dark, staring intently at a space we perceive as empty, just hours before a tragedy occurs. These anecdotes are frequent in clinical settings. Doctors and hospice nurses often report therapy dogs becoming tethered to specific patients during their final hours. The dog lies motionless beside the bed until the patient passes away. Humans have observed these vigils for millennia. Without a biological explanation, cultures across history assumed dogs possessed a supernatural connection to a spirit world we couldn't see. The ancient Egyptians formalized this belief, casting dogs as the designated protectors of souls. They trusted these animals to guide the deceased safely into the afterlife. While modern observers still wonder if a growl at an empty corner signals a ghost, the reality is more grounded. A dog staring into the dark is responding to physical inputs that remain entirely invisible to human senses. The ultimate shutdown of the human body is a profound physiological event that releases a distinct cascade of biological signals. As organs fail, the body begins to vent specific compounds into the air. We lack the hardware to detect these signals. This chart compares our 5 million scent receptors to the 300 million found in many dogs. This massive sensory gap allows them to identify chemical changes we cannot even imagine. These signals include volatile organic compounds, or VOCs, which a failing body exhales into the room. We already utilize this capability in medicine. Specially trained dogs can identify the chemical signatures of complex cancers, severe bacterial infections, and sudden drops in blood sugar. Some remarkable dogs can even alert their vulnerable owners to an impending seizure up to a full hour before it happens. During a person's final hours, the room fills with a dense, detectable chemical profile. To a dog, this scent is an undeniable indicator of a body in transition. Clinical environments provide a clear view of this phenomenon. In these words, staff have documented canine reactions occurring in perfect synchronization with microscopic physiological shifts. Heightened hearing adds another layer to their diagnostic picture. This visualization maps a failing heart rate and irregular breathing. These subtle rhythmic changes fall well within canine auditory thresholds, allowing the dog to hear the body's systems falter. As circulation slows, the patient's core body temperature also begins to drop. A dog resting nearby feels this loss of radiating heat instantly. By combining scent, sound, and temperature, the dog observes biological failure in high definition. They are processing a data-rich warning sign that humans simply cannot perceive. Sensory data explains how a dog knows a person is dying, but it doesn't explain their behavior. Biology alone cannot account for their sudden protectiveness or their refusal to leave the room. The answer lies in evolutionary psychology. Thousands of years of coevolution have made dogs uniquely attuned to human vulnerability and emotional shifts. Dogs perceive their human owners as their primary source of safety in their entire pack structure. When a dog detects the chemical and auditory signals of a body shutting down, they recognize a profound threat to the most important member of their pack. Evolution provided dogs with one primary tool to handle a vulnerable pack member: physical closeness. The final vigil, the refusal to leave a doorway or a bedside, is a primal protective instinct triggered by deep distress. While science has replaced paranormal myths with the study of chemistry and biology, the weight of the dog's behavior remains. The true sixth sense is the intersection of 300 million scent receptors and an evolutionary drive that compels them